work on the Illiopsoas muscle as well as evening out your client's legs. This technique can be done by you as a massage therapist or by you as the lay person. So for those of you who don't know, the Illiopsoas muscle starts right here, but it's underneath all of the intestines and everything. It attaches to the front of the spine, and it comes down and divides into two and attaches on the inner upper thigh, the top of the femur. So it's a little bit difficult to work on, but it is very important, and the technique that I'm going to show you is going to be the easiest way. It's also going to help your client walk and step evenly, and it's going to even their legs out. So we're going to take a look first of all at her feet down here. And what you want to do is you want to grab their feet by the ankles like this and just pull gently. I'm just leaning back a little bit, and what you can see here is how her heel is not evened up very good. You see, it's not, see how much shorter this leg is than the other one. So once you've determined which leg is the shortest one on your client, you come back up to their stomach. And with the first landmark that you want to find is their belly button, which is here. And you want to know where their hip bone is, which is right here. And you want to go about halfway in between, which is going to be here. Here's her hip bone, here's her belly button right here. And we want to go right about here. On some people who may have a little bit bigger belly, you may have to go a little bit lower because you want to kind of get under all of that because the psoas muscle's under everything. So, and we're going to use the side of our hand. A lot of people like to go in with their fingers, but that hurts a lot, and this is way less work by using the side of your hand. And for those of you who want to work on your body mechanics, you just want to lunge back with your back leg and just push your hand in right here. With your other hand, you're going to be putting it on their knee, and you're going to be wiggling their knee back and forth like this while you're applying pressure here. A fair amount of pressure is applied to the stomach while you're doing this. And you're also going to be pushing slightly in and downward on the knee. A lot of times you'll feel the knee move down. You may have to get your grip again because the knee's moving because the leg's getting longer. Sometimes you'll feel the psoas muscle moving under your hand. You won't all the time. You don't necessarily have to. It's good if you can. You're not going to be able to on everybody, but it is a good indicator that you're on the right spot. But pretty much if you're putting some good pressure here in between these two landmarks and you're moving the knee, it's going to work, and the psoas is going to get stretched back out. So let's take a look at her legs and see how they are now. And as we can see, they're pretty even, but now what we see is that this one is just a little bit shorter, maybe a millimeter or two short. So what we're going to do is go ahead and do the same thing on this side. Now, I would just like to say that there's no way that you're going to make it any longer than it should be. The muscle's not going to stretch out any further than it should, so her legs will eventually even out. So we're going to do the same thing here. We're going to find the belly button, the iliac crest. We're going to go right in between, and just a little lower really than halfway. We're really closer to the iliac crest than we are the belly button. And we're just going to go in with the side of our hands. We're going to lunge forward. The other hand is gripped here. And we're just going to wiggle this, 10, 15 times until you feel like you've done some good work. I can definitely feel her psoas moving under my hand here. Your client is not going to feel anything more than pressure, sometimes slight discomfort, but the relief they get from this is totally worth it. And I would never recommend you doing this to your client without talking to them about it first. Alright, so let's see what's happened here. And as you can see, this one needs to be done again. So we're going to go ahead and do it again. And this is pretty much the process you have to go through back and forth until you get it right, because the psoas muscle tends to draw way up. So let's do it one more time and see if we can get it evened out this time. Don't worry if you have to go back and forth 4 or 5 times. That's common. It just means that they really needed you to work on their psoas. Alright, let's see. There we go. Now, we see her feet are nice and even now. She'll be stepping evenly. She'll be walking evenly. Her hips are going to feel good. So thanks everybody for watching. I hope this helps you. If you have any questions, you can post them and I'll try to help you.